today's video I'm going to be talking about my chronic lower back pain and how it affects me.
And trying to remain so strong. I know it's good if I'm wrong. I got it, running to better times.
So I'm in a slightly different setting today. I am going to be trying out this background. I'm trying a few different areas of my flat to see which one kind of gives me the best lighting, the best effect. So bear with me whilst I actually figure this out. So first of all, I just wanted to talk about how it all started and my first big memory. So it was after a full day shift at the retail job that I'd had at the time. So I had come back from this shift and I'd gone upstairs, and at the time I was living at my parents' house. And so it was mine and my brother's thing, and this was years ago. So this was a good 3 or 4 years ago. But we used to play games on my bed. So he would come into my bedroom and we would sit there and we'd play games and we'd have a chat, and he'd ask me how my day was. To put it in perspective, my brother is 10 years younger than me, but he's got a very mature sort of head on him. He's very, very he's very aware of his surroundings and the world around him, which reminds me of me when I was younger. So that's kind of, I think, why we had such a good relationship and why we still do have a decent relationship. So he came into my bedroom and we were sitting on my bed playing these games. I think there was a few on Roblox at the time, there was a few on Steam, there was just a few games, and we just decided what we were going to do there and then. So we sat down and we were playing, and I just started to feel really, really in pain. Like, I knew I was tired because this was my first ever complete day shift. Before that, I had done shifts at this job, but I'd only done half day shifts. And so I'd got home, I'd sat on my bed, and literally my brother wasn't even in my room for very long. Usually when I came home from work, we would sit there for 1 to 2 hours and we'd play games. Literally after half an hour, I was like, I need to sleep. I'm in so much pain and I have no idea why, but it's probably just because, because I'm in pain because I've just done a whole day of work sort of thing, which isn't normal, but I kind of thought it was normal. But it really isn't. Like, you shouldn't come home from a day of work and be in that much pain. So I then tried to get up and I couldn't. Like, I could, but it was just so much pain. Literally pain beyond my belief. I'd never had so much pain. I literally had soaring and searing lower back pain, and to the point where this back pain meant that I was almost paralysed in a way. I wasn't paralysed, but I was very much unable to get out of bed. And obviously, usually you clean your teeth, you get in your pyjamas and stuff. I couldn't even do that. I literally had to sleep in the clothes that I'd gone to work in, and I literally had to shuffle my bum down into bed and just sleep. I had no other way to get into bed. This wasn't a bit of pain where I'm like, ow, ow, it kind of hurts. It was to the point where I couldn't stand up. It was so painful. I woke up the next morning and I had work. I was still in quite a bit of pain, but it was nowhere near as bad as what it was last night. But little did I know that this was the start of my pain journey, basically, and this was the very, very start of all of the issues I was going to have with my back. I was then referred to my GP. I went via so many different avenues here in the UK. And I was told, oh, just keep taking paracetamol, just, if you need to, take codeine, which is the next step up. But apart from that, you're fine, you don't need anything. And I was pretty much told it was my weight. I was just told it was my weight. There was no other reason for it. It was literally because I was a bigger girl, which kind of made sense. But I did have a lot of doctors say it to me in such an abrupt way that, and for somebody like myself who has had an eating disorder in the past, being told, oh, you've got to lose X percentage of your weight, and not really being given any sort of guidance and strategies and help to do that, it's quite harsh in a way, because you're sitting there thinking, okay, yeah, do you think I'm in complete denial as to the fact that I'm big? I know I'm big, I know I need to lose weight, but if you're gonna just sit there and bluntly tell me that, then I'm not gonna do it, because you're not adapting your thing to me, and you're not even giving me any sort of way to do it. You're just saying you need to lose X percentage of your weight, and that's a story time for another different day. Until I was then referred to rheumatology. So rheumatology is, I think, I'll put the definition on screen, but I think rheumatology is the study of the blood, and basically to make sure that you haven't got, it's basically they were ruling out arthritis. They did blood tests to see if I had this certain, I don't know, white cell maybe, I don't know what it is, that shows up as like the arthritic or the arthritis condition. So I didn't have that. So they then also wanted to check to see whether there was any sort of arthritis or any sort of anything else in my body. So at the time my hands were hurting quite a bit, but I think that was because of what I was doing. So because I was working in retail, obviously I was using my hands a lot more and using my joints in my hands. So they did a ultrasound on both my hands and they found no arthritis in my hands, and they did a bit on my wrist, found absolutely, apart from like a fracture, a healing fracture that I'd had previously, you know, they didn't really find anything. So after that I was then diagnosed with a condition called fibromyalgia. And I no longer have that condition because I basically was diagnosed with it as more of a, well, you've got this condition as a fob off sort of thing. And a lot of doctors, when you ask them, what is fibromyalgia? A lot of them just say, it's just pain, but there's no explanation for it. So like borderline personality disorder, there is a huge stigma around it because doctors just think, well, there's no physical evidence for having fibromyalgia, so therefore you could be making it up and you still have this condition. So there's a lot of stigma related to that. So I had this condition, fibromyalgia, for I would say maybe 18 months, and then because of my pain and because like most of my pain was in my back and my hips, and this is where the rheumatologist didn't listen to me. They basically was like, okay, you've got pain, you haven't got arthritis, so we're going to give you the diagnosis of fibromyalgia. And at the time I kind of thought, okay, yeah, at least I've got an answer. Little did I know that basically every single doctor in the world thinks that fibromyalgia is a form of condition, and it is a condition that people don't really take seriously. So I was continuing to have pain, I was continuing to have something called sciatica, which I will explain a bit later in the video, but I was basically getting worse and worse. And it was all in my back and hips, and it was really, really bad. So I was then referred off to the pain management doctor at the hospital. So from this, I saw the pain management doctor. He asked me, like, all the, the bits and pieces in terms of what my current diagnosis was and where the pain mainly was. And I said to him, my current diagnosis is fibromyalgia, and like most of my pain's back and hips. And he goes, okay, whereabouts in your back? I said, well, my lower back, so like a little bit above my hips, sort of my hip joints. And he said, okay, so whereabouts, like if you were to put it in relation to say your belly button or like, your stomach, like your rib cage, whereabouts is it? And I said, well, kind of in the same area but on the back as my belly button. And he goes, okay, so like you draw a straight line through your body and that would be where it is. And I goes, yeah, kind of like that, but that's only mild pain, but lower than that is where it gets really bad. And he said, okay, so that's like an L5 position. And I didn't really understand what he was saying to begin with. But basically, I'll put a back diagram on the screen. He basically ended up diagnosing me with chronic lower back pain of the L5 to S1, which is a portion of your back that causes chronic pain. And I still have it to this day. I have good days, I have bad days, I have medium days. So I have some days where, like today, I would say is more of a medium day where I am in pain. I constantly have pain. I never don't have any pain. But it's a medium day because yesterday I was losing my balance and I needed to use my crutch, which, by the way, there is no stigma in somebody like me, like my age, using a mobility aid, which I will do in a completely separate video about stigma and mobility aids. But I had 2 days of really hard, lots of back pain, and to the point where literally I was almost having this numbness in the bottom of my back because there was just so much pain. So after receiving the diagnosis of chronic lower back pain of the L5 to S1, this is when I did some research myself, and I found that basically a lot of my other conditions that I have and my other symptoms are related to, the pain. So this is where I'm going to get on to how my back pain affects me and how it manifests in me. This might be completely different to somebody else with the chronic lower back pain of the L5 to S1. Even though we have the same condition, there might be, differences in how it manifests. So the first and probably most biggest thing that I need to mention is pain. Pain and chronic pain to the point where I'm never not in pain. The second one is tiredness. So I get a lot of tiredness, a lot of fatigue. I end up having to have lots of naps, and I know that may seem absolutely stupid, but when you're so tired that you can't function, you basically need to nap. So that was, one thing that I want to get clear, the fact that I get so tired that I have to nap. So as previously mentioned in the video, I used to seize up, and I do still seize up on occasion. I find that I seize up and then I can't move, and I literally either have to almost walk around like an old lady with like my back kind of, you know, almost bent over in a way, which I feel just like 5 times my age, which is like 100, but I still feel like really old when like I'm seizing up and I can't really straighten my back up to be straight or anything like that. Another thing and how it affects me is I get a condition called sciatica, which I did briefly mention in sort of the beginning of this video. So sciatica is basically shooting pain. Like in a nutshell, it is shooting pain. It is shooting pain that comes from your back, goes through your hips, and then causes like a weakness in your legs. People can collapse with it, like as in like they lose their balance so much that they fall to the ground. They can like not be able to put their foot down. Like, and for me, I had one occurrence where I just couldn't put my foot down. As also previously mentioned, I need to use mobility aids every now and again. I do have a pair of crutches which I was given from the hospital, which were under the proviso that I would use them when I need them and don't use them when I don't need them, sort of thing. So when I'm having a really bad day or I'm having a medium day but there's the potential for it to get worse, say if I'm going out and I'm doing things, there's a potential for it to get worse because I'm actually being active and that's, you know, hurting my back. So if I'm having a hard day, I use my crutch all the time. If I'm having a medium day but I'm doing things out and about where I haven't necessarily got things to grab onto, I'll use a crutch because that just makes it so much easier for me. So I think I have rambled enough. I think I have gone through everything that and how my back pain has affected me. Thank you very, very much for watching. And if you would like to learn more about some of my physical health conditions and my mental health conditions, I will leave the cards along this video, which you probably would have seen, but I'll also leave the most relevant video on my end screen, which is going to be appearing in the next couple of seconds. Please don't forget to hit that subscribe button and to like this video if you liked it. And I will see you in my next one.
Nobody can make her feel down. She was always smiling from me to